Fantastic. Well, just for the sake of the recording, thank you again, everybody, for taking the time to join today. And I am Tony O'Boyle. I'm a member of the IARPC Secretariat, and very happy to be with you all today to discuss IARPC, the Arctic Research Plan, and specifically how they relate to communities, resilience, and health topics. So thank you, Serena. What we're looking at now is our agenda for today. So again, I'll be here to provide kind of a brief overview of the plan and development process. We're going to hear a little bit from our community resilience and health team leads on just kind of like a high level look at the focus and accomplishments of the team. But a bulk of the session is meant to be discussion, an opportunity to hear from you all on, what you think some of the priority issues and topics are to be considering for our next Arctic research plan. So we can go to the next slide. So just before we dive into all that, I just wanted to give a little bit of context about IARPC. So, many of you may be aware of IARPC's mission and function, but for anybody who is newer, IARPC is an interagency working group of the National Science and Technology Council, and we are tasked with enhancing research in the Arctic by bringing together federal agencies to coordinate and enhance their work. So we facilitate conversations and build connections among federal agencies, researchers, Arctic communities, others who live and work in the Arctic, both in the US and internationally. So to do this, we bring together leaders from 18 different agencies, departments, and offices from across the US federal government. And we can go to the next slide. And we also run IARPC Collaborations, which is our web platform that facilitates collaboration between our federal agencies and our non-federal groups and researchers with interest in the Arctic region. So right now, IARPC Collaborations has over 4,200 members at this point, spanning different disciplines, agencies, organizations, and countries. And on IARPC Collaborations, we host a number of different teams, including the Community Resilience and Health Collaboration team, who's hosting this webinar today, and we'll again hear a little bit more about that team in just a moment. And again, some historical context. IARPC was created in 1984 under the Arctic Research and Policy Act, or ARPA, and this act called for a comprehensive national policy focused on research needs and objectives in the Arctic, and we're required to update that plan every 5 years. So the work of IARPC and of IARPC Collaborations is organized around that National Arctic Research Plan, which outlines areas for collaboration amongst U.S. federal agencies and researchers. So we are currently implementing the Arctic Research Plan for 2022 through 2026, and this meeting today is part of our effort to seek input on what the Arctic Research Plan for 2027 to 2031 should look like. So just for reference, I'll put some links in the chat where you can read a little bit more about the plan. Oh, would it be helpful if I sent it? There we go. So in this meeting, we're not going to go too deep into like the full structure or background on the current plan. We did host a webinar in September that was more of an information session on the Arctic Research Plan. So I'll post a link to that in the chat. Oh, there is a recording if you want to catch up. But as far as process, so on November 15th, we closed the Federal Register notice soliciting input on the next Arctic research plan, but due to the government shutdown, we had postponed and now reschedule a couple of listening sessions, this one included. So any input submitted during this session will be equally considered for the next plan. And we also still do have an active plan at iarpiccollaborations.org email that I'll put in the chat. That if you, as a result of this listening session, like still want to submit written input, that would be the place to send it. We do ask that you do so before the end of December, because beginning in January is when the federal drafting team is going to come together, be assembled to consider all the public and federal input and actually put together that first draft of the plan for 2027 to 2031. And once that draft plan is developed and reviewed and cleared, It's going to be released publicly for another round of public input, review, and comment. So right now, that will likely be in like late spring of next year. Um, Once all that input is received, another round of drafting with that federal drafting team, um, with an eye to hopefully release the new plan early to mid 2027. Uh, Timeline subject to change as we continue to navigate what surprises come our way. So that is our current timeline, but we'll communicate any updates as they happen or become available. And just like today's meeting, just for awareness, if it's in anybody's wheelhouse and an interest, in addition to today's listening session, we also have a couple more listening sessions that were rescheduled um, due to the government shutdown or were, taking place after that November 15th date. So we've got another one tomorrow, same time slot, 11 to 12 Alaska time, hosted by the Risk Management and Hazard Mitigation team. And then next week on Tuesday, December 16th, IARPIC has got a town hall at AGU where we'll also be welcoming input on the next plan. And then I think we've got one more slide here. Yes. So if you're looking for more information about the development of the Arctic Research Plan or like have any questions about the process, you can either visit this website here, and I'll put a link into the chat, or again, I'll post it here. Email the Secretariat directly at that plan at iarpiccollaborations.org email. Um, we're also happy now to take a few moments if there are any questions more on sort of like the process of developing the new plan. Bearing in mind, again, we are hoping to hold like a good chunk of this call for discussion and input, but if there's anything we can clarify right now, we are happy to do so. So if there's anything process wise, you can raise your hand or pop it in the chat or come off mute to let us know. Okay. Well, not seeing anything. If anything does come up, again, feel free to use that chat feature. But since I don't see anything yet, I will turn it over to one of our co-leads, Heather, to give us that overview of the community resilience and health team.
Great, thank you. I'm Heather Scobie, and I'm representing our team here today. We're called the Community Resilience and Health Team, and there's a blurb here on the slide about what we do, which is improving community resilience and well-being by strengthening research and developing tools to increase understanding of interdependent social, natural, and built systems in the Arctic. Next slide. These are some objectives in the current Arctic Research Plan. So the first one is about research on public health needs and delivery. The second one is about food safety and security, including research on how environmental change is affecting these things, and the use of traditional foods and traditional way of life. And the third objective is on research and technical support for water and sanitation infrastructure, which is really relevant in the Arctic. Next slide. These are some accomplishments from the current period of the plan. And these come out of the 2024 report to Congress, which is publicly available online. So some things we wanted to highlight were the development and evaluation of remediation and treatment strategies for PFAS, the connecting local and indigenous community members with federal agencies and researchers to improve food security and storage. There was also some work in remote communities of Alaska on testing and treatment for diseases like hepatitis C, and collaborating with Alaska communities to develop a coastal flood hazard assessment tool. Next slide. So I'm going to turn it over to Sarah Yoder to facilitate these questions.
Hi, everyone. Great to see some familiar faces. Like Heather, I am one of the co-leads. There are several on this call, but one of the co-leads for the Community Resilience and Health team. So we have some specific questions that we can address. Also, since it's a small group, we could, hear from everyone on the call with some more general questions. But we wanted to put a few things on the slide that people can consider. Um, and just in general, what are critical issues and needs? Where federally funded science, engineering, and technology research should provide knowledge to promote sound decision making at all levels related to the Arctic. So when we're thinking specifically about community resilience and health, we are really eager to know the thoughts of folks on this call, or people maybe watching the webinar later. What research topics should be emphasized to address these needs in the next plan? What updates should be made to the plan? And what should stay the same? Was there something that was super compelling or was really maybe you were involved in and would like to see that carry forward? So we'll pause here and see if anyone has thoughts on these particular questions. And if not, I can kind of pose some more general questions that might be a little easier to address, and it'll still get us there.
And I'll put these questions in the chat. So yeah, so that we can take the slide down and see one another.
So if anyone has any questions, feel free to come off mute, pop things in the chat. Take information a variety of ways.
Well, if nobody else is going to say anything, just to move us along, I think the coastal hazard assessment tool is definitely needed, but we also, I think, need a permafrost degradation or whatever you want to call it, hazard assessment tool, and we need these things to have kind of try to do adjustable timescales so people can kind of model it. I mean, if you're building something that's going to be there for 2 years, it's not a big deal if you think the permafrost is going to collapse in 20 years or the erosion is going to hit there in 20 years. If, on the other hand, you're building a new school, you really would like that to be okay for at least 50 years. Because it's really expensive and all that happy stuff. So I think but they need, the other thing is that there needs to be the way these are presented is very important. I mean, there are some people, I lived in Reykjavik for 26 years, and still spend a lot of time up there. And, there are some people who fully paid attention to what the science is, suggesting as a possibility and are thinking about, we're going to need to move. And some of these are older people. And there's other people that, nah, that's not a problem. And, some of them it's because they're, at least in part because they're in politics and you don't want to hear what you don't want to hear, right? But we need to consider how it is presented so it's not too scary, but at the same time, people can see what the possibilities are. And maybe focusing on things like for coastal hazards and stuff, focusing on things like dumps on the areas around communities, whatever, most heavily. Because some of the coastal hazard stuff I've seen is either so coarse-grained it's completely useless, or some of the coastal erosion maps are kind of nonsensical. I mean, there's one that indicates that, Newville, the tip of Point Barrow is accreting. Sorry, I have lots of very specific to the centimeter data that shows it's retreated over 150 meters in the period that they claim it's retreated. So when you put something like that out and everybody in town knows they're like, yeah, right, whatever. Scientists don't know what they're talking about, and that's it. So those are just things we need to consider. I don't.
Thank you so much for that feedback, Anne. And I definitely think there's a place in the plan to incorporate community knowledge, indigenous knowledge into the work that we're doing. And so um, thank you for sharing. Does anyone have any maybe reactions to what Anne shared or something that has come up to mind as she was talking? Okay, quiet group today.
Well, I
That's
do,
okay.
I do want to
Oh,
echo, I do, hi, Rainey, I'm here, in the interior, just in Fairbanks, essentially. And I do want to echo some support for Anne's reflections. And for me, for the last 25 years, that space of lived experience of community members, of researchers, of folks that have had a lot of on the ground experience in the North, those who've had some or had some before and now are coming back. Like it's a really complex and really rich area of a lot of experience to surface. So, like for Anne and so many that have been, and now early career, this time and space for this next, plan moving forward, and 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 what hasn't been caught in previous work, and what the speed of change is such that that opportunity for the reflections of people just like Anne shared or others in community or in this space, there's there's this opportunity for kind of complexity and team science to find a way to respond to the communities even faster. And I'll drop a couple links in the chat, but it is an opportunity to slow it down, to really listen to exactly what Anne was saying. Thank you for following as best you.
thanks, Rami. I'm curious, do you have any specific topics that you're interested in um, in the community and resilience and health area, kind of along with the lines of what you were talking about?
Yes. And I'm hesitant because I think there are more than what we're aware of even. And so with international relationships, with Yukon and Alaska, with rivers, with, you know, the health and well-being responsiveness to the lived experience of how we figure out what we're going to do, just like those few links that I put in there. There's the team science, the network science, and then how we take care of each other with childcare, with field work, with engagement with communities coming back and forth, and how we slow that process down when everything is just speeding up. I think we have a lot of opportunities to work in very interdisciplinary practice in the co-production of what these plans can be. And literally in what I mean by co-production, and what isn't then my business to determine what is and isn't co-production. So in this health and my mom and others of us were part of the geriatric education grant in the early 2000s with the university program, the UA program, and what happened to that, and then so this space is so rich for others that are curious, maybe not so much in Arctic, but they are curious in health and well-being and polar issues and these next few years. Thank you for the time, but this is such a rich environment, and it is internationally.
Great. Thank you for adding some additional information to that. Thank you. Okay, so I think there's a couple folks on the call who we haven't heard from, and totally fine. But are there anyone who has specific topics that they're interested in seeing carry forward in a new plan, or some major concerns that they have maybe in their work that they are doing? If you are researching harmful algal blooms, maybe there's some components that could be put into the new Arctic research plan, or maybe you're in a specific community and have some particular concerns related to resilience and health. Hey, Thomas.
Yeah, hey, I thought that was calling me out, so I thought I might as well mention something. Yeah, no, so my name's Thomas Ferrugia. I work for the Alaska Ocean Observing System, and I coordinate the Alaska Harmful Algal Bloom Network. So I put in kind of on behalf of the Alaska Harmful Algal Bloom Network, public comment on the Arctic plan, Arctic research plan. But I think even, I mean, it's beyond the harmful algal blooms. I mean, I have a marine focus, but anything that has to do with um, living marine resources and their use and subsistence and cultural activities, I think is a big part of future resilience work. And so supporting work both by the communities themselves and by researchers um, to better understand kind of the future of those resources more generally would be important. And then so a part of that is food safety and food security for marine resources, and harmful algal blooms fits within that within a One Health context. So but yeah, that's kind of the lens that I'm looking at it through. And like I said, I put in a comment about that already, but I think it can apply to so many different aspects of work that's being done by communities and researchers. Um, so yeah.
Thanks, Thomas. Didn't mean to put you directly on the spot, so that was my casual approach to that. Thank you.
Yeah, I since I had put in a comment already, I just didn't know if
Perfect.
we wanted to talk about that some more or not, but yeah.
Yeah. Right. And any other folks?
And I would invite too, like even if some of our current leads, I know you're like very much in it in terms of like the what IARPIC is doing on this front, but if there's like anything that's top of mind for you in the plan, not in the plan, just in sort of like a professional work context, um, yeah, there's definitely also a space to like offer that up and maybe that sparks something for folks.
I have a kind of a quick follow-up, and this is just trying to hear the input and make sure, just trying to gauge, I guess, with my question is knowing what our colleagues on the phone today, knowing what they do know about IARPIC and these different federal agencies, where we are in this larger, international and Arctic picture, is there anything specific you think, given this coalition of federal agencies working in the Arctic, if there's anything specific on the community level that would be asked of these, this collaboration, either IARPIC or through the, individual agencies working together? Is there anything, and that's kind of a very broad general question, but just trying to see, based on these great ideas, like if, ensuring where you would want the federal government to be involved in that versus where obviously the community should be leading a lot of these, or, leading the input and the design, I think, in my opinion, but just kind of gauging where the input is and where you would see these agencies participate, or if you have any specific ideas of what you'd like to see from IARPIC, if that makes sense.
I guess I see researchers, I see people, I see cousins and aunties, I see young people and older people, people with experience, and agencies and the feds are just people. And so however any of us take care of this work that we're doing, yeah, it's got to be deliverables. Like it's got to stick as best as it possibly can. But we also have to try to see each other through this. And these are rich and complex times. And so whether it's living on the western coast of Alaska or living on the west coast of the United States or living on, like, wow. So whatever we do, however we organize with IARPIC or the positions and everything, this lived experience that we can help others then benefit from this to continue to respond to what the actual needs are on the ground, not more of the same as the one thing we can count on. So we can embrace that and really try to figure out then as individual researchers, as parents, as cousins, as kids, as whatever, we really need to do what we can with federal agencies, with the big budgets, with institutions to figure out how to get through this time, these next few years and leading into then 2031, 2032. This richness of this opportunity has to be rooted in all the relationships that we have.
Just want to say thank you for the response. And I know I feel sometimes my brain doesn't work as fast as the dialogue and the discussion or some of the questions. And so I think Tony's mentioned, or Sarah too, that the IARPIC is open and available. There are ways to provide input, after this discussion, after, some more thought or so definitely don't want to leave it as this is the one opportunity, the one window where we're receiving input.
One thing that occurs to me that, federal agencies, because there's a number of them funding projects. But sometimes this is a problem even within a single agency, cross direct different directorates at NSF, for example. There are times when communities are simply swamped by research projects. I mean, I think at one point, Point Lay probably had almost as many researchers in town as there are adult residents, which is ridiculous. And talk about research fatigue. And I'm not sure they're going to get much out of it, partly because they moved the village to the wrong place. But anyway, and some of it, the stuff that was being done seemed mighty redundant. And so possibly IARPIC, I mean, it's great you're putting, IARPIC is really good at putting researchers together and building teams outside, but it doesn't really tie in well with the communities. And it also doesn't, and I don't know exactly how you do this, but thinking of some way to have a framework where different agencies consult and maybe try not to fund 6 projects doing six overlapping projects in one community. Maybe, have some of them in different communities, maybe try, maybe have multiple funding agencies, a bigger team that works, in several different communities, because that also could potentially make it easier to scale it or apply it to other, even more communities or whatever. But, it really is becoming more and more of a problem, and it's something people comment, I hear about a lot when I was living there, and there's comments on Facebook all the time. So, it really is something that it's got to be addressed. And IARPIC may be a place that could do that because of the cross-cutting sort of things. Anyway, that's just a thought.
Big time. That's a really good point. And I've definitely heard that in communities as well. And I don't know if there's anything on the IARPIC side, if anyone wants to respond to that, or just leave it for now. Noted, and we will review. Yeah. Okay. Thanks, Gideon.
Yeah, I think it is
yeah.
definitely good to note, and it's sort of like
Yeah.
I think it speaks to the core of the mission and also the challenge in collaboration. Um, but definitely agree a big part of like bringing together agencies along with non-fed groups is like where are we potentially duplicating efforts? Where can we streamline? Where can collaboration like make things a little bit more um, not only efficient, but impactful. But efficiency is a big part of that. Because doing work somewhere like it doesn't always mean it's almost sort of like too much of a good thing. You're all trying to do the same research, maybe for a good reason, but if it's all happening with the same strapped communities in the same place, like it doesn't have the intended impact. So I think across the work, it's something very important to consider.
Yeah, and I'll add, and maybe this is my comment. Um, potentially, supporting, I know there's regional health orgs and other regional serving organizations who are, talking about setting up research centers. And maybe there is a way for federal funding to kind of support the development of those centers that can kind of help manage all the research being done in their communities. Okay, so feel free to stay off um, the mic, but if you're interested, either Daniel or Rebecca, maybe even just sharing what you're working on in the Arctic, can help this conversation, or just want to give a chance for everyone on the call to chime in. Okay, I see your note. Thanks, Rebecca. Anyone else? Participants, co-leads, anyone?
I think just a comment since there's a little bit of a gap here that not only is it difficult to coordinate across agencies, but even our own agencies, most of the agencies like our CDC field station here in Anchorage, we're a small field station in a giant agency. And I will say there's definitely, and our field stations existed in Alaska for over 50 years, and we still have surprise teams from CDC that come to Alaska to do some sort of work, and we have no idea that they're coming. And that's something that we're constantly working on. And I would say doesn't happen often anymore, thankfully, but I know there's kind of that background. So it's definitely it's important to highlight that, and I just want to recognize that even within one agency, especially since none of us are headquartered, none of our agencies are headquartered in Alaska, that we our field stations and satellite offices here, I'm sure across agencies, are always constantly trying to make sure we're connected and that we're aware when other agency colleagues are here and doing something maybe completely outside of our mission or scope, but it's nice to know at least. And I will say too, I think those conversations are important. I think that with a lot of leadership change, I'm only speaking our agency, but with a lot of leadership and change and turnover, it's just kind of a constant thing and communication task that we have to do. And I think we've made real strides, our program has, and we do have now other programs far across the agency that will reach out to us if they're planning to do work in the Arctic, if they're planning to do work with Indigenous communities, and through our partnerships, which are critical to us here in the Arctic and in Alaska, I think we've been able to really expand that awareness across our agency in the last couple of years and really seen improvement, where we're even having other agency colleagues know to go through, like, for example, tribal review for projects and manuscripts and stuff. And that's been just continuing advocacy for that. So definitely just something that's recognized, and just letting you know that I think, we just keep working on it and just keep communicating together, so, but just want to give that example.
I definitely want to just voice my support and gratitude for all the individuals and for our Arctic the last few years. My health took a really bad turn a dozen years ago, and the pandemic and the technology and everything kind of allowed, and how you've all handled everything these last few years, and the confidence that I have in not knowing what's going to happen. But the fact that you all keep showing up, you all have done amazing, and the flood is going to keep coming. And so I just can be, I say this all the time, I just, a lot of encouragement. It's dizzying, but yeah, thank you. You're just, it really is amazing what you all pulled off.
Thank you. That means a lot. Thank you very much.
It's helped save my life. It's messy work, this work in the communities and change. And then especially top down. And then when
Yeah.
and voices difference. And so yeah, it's messy, but it's okay.
That's basically what we try and encourage with our partners in Atlanta for sure. Don't be, I think a lot of folks that do not have as close connection or collaborations, especially with indigenous communities, and of course, any knowledge about the Arctic, I think there's a little I want to say just hesitancy or intimidation to reach out and basically say I know nothing but I want to talk about this, or I want to, this is something I think is helpful, but I know nothing about, and yeah, so it's just encouraging folks it'll be okay. It won't be perfect, it'll be okay, but that community engagement's super important. It's
Well, it
critical.
is, and for a number of reasons. One, if you actually wanted, I mean, there's a lot of public health survey kind of stuff that you might want to
Right.
do. You're not going to get responses if you're not tied into the community, if you haven't, educated the community. These aren't like some crazy people coming around, that they're actually working with your tribe or your regional tribal organization or whatever. And not to mention, rural healthcare mostly is provided by various tribal organizations, ANTHC, Alaska Area Native Health Service. I mean, the hospital in Utqiagvik, which provided, emergency care for everybody, native, not native, Samoan, it didn't matter, that was a tribal organization, so if they want to deal with rural healthcare, they need to deal with these, they have to do it. And, if you keep disrespecting people, I mean, it's literally a government to government relationship. That's what they apparently aren't getting. I mean, they wouldn't just march into England and start, to Great Britain and
Yeah.
start doing research. I mean, and in effect, that's, if they're working with tribal, members, that's what they're kind of doing. And, that shouldn't be a hard thing for people. Once they understand that it is, in fact, and they should be able to get that it is a government to government relationship, it shouldn't be that hard to figure out that you got to work it out. Not to mention, probably most of them are urban, so they don't understand about small towns of any makeup. But if you don't get yourself connected, you're not going to get valid data. I mean, I'm an anthropologist and an archaeologist, and you have to make the connections or you get nonsense. I mean, I've seen stuff and I've
Right.
also done surveys on similar topics. And let me tell you, the difference was astounding. I actually kind of did the survey because some of the reported results that people were spouting were like, really? It just sounds kind of wrong. It'd be like somebody telling me the sky was green. And, I mean, so yeah, however you can do it. And I totally sympathize with you because it's tough. And there is all the turnover. But, I don't know if there's some kind of educational thing,
Well, I think you're right. I mean, you definitely brought up another really excellent argument that we do use, and that is, if you want good data, if you want good, to do good science, to do good data, you do have to know all the contributing factors, which is the community. So,
yeah.
and that's something, I think that's something that IARPIC does recognize, and that we, in the
Yeah.
uniqueness of the Arctic and how in the end, we ultimately are serving the communities. We're, advancing research in the Arctic, and it's good science. It's good, based on good scientific practices. Um, so that's another angle that we've used with maybe some reluctant colleagues that are, still a little bit more hesitant or timid about opening those conversations. And it's like, well, if you want good science, you need to know these things. And I have lots of examples where, you know,
Sure you do.
yeah, I mean, just, in terms of pulling data from databases that are accessible or other things, and it's just not the full picture. And so it's not actually the real results. And so I think that that's something that, that's the great part about the IARPIC interagency
Yeah.
collaboration too, is we all have that same experience. And in terms of the important impact of, communities and Arctic environment and everything in between, and can advocate for that. You know, so
I mean,
so yeah, you bring up I think another really like a pillar of why it's important to um,
yeah.
that local and community level input. So
Yeah, if you're not
a
getting
lot
good,
of IARPIC members bring that expertise. So that's something
yeah, if you're not
continue
getting
to,
good
yeah.
data, you're wasting taxpayer money, and you waste enough of it. I mean, they're already, waste practice, waste time abuse. But if you're not doing something that's, I don't know, it'd be like trying to study something in the ocean and not bothering to, collect temperature data or something,
Yeah.
um, I mean, it's about yeah. Anyway, so that's yeah. I mean, good luck. Appreciate all you try to do.
Hey, I think we may have heard from everyone who wanted to speak today. Before I turn it back over to Tony, just wanted to, thank everyone for joining, and it was really great to have this conversation and hear your input. So thanks for taking the time. All right, Tony.
Yeah, thank you, Sarah, and thank you for everyone for being here. And I guess I'll just close by saying, like, obviously this was like a distinct session in which we're seeking input on this next plan, but um, our hope is that like any public meeting that any of our teams hold, anything through IARPIC, the IARPIC collaboration space, like it is an ongoing discussion and it is a place where you can like poke and prod at things and raise the messy issues. So really appreciate the conversation that we had here today. And I guess I just wanted to voice like definitely feel free to bring that into like any of our meetings in the future, whether it's this year under the current plan, the next 5 years under the next plan. I think that's what makes like this space so important and valuable is to like continue to return to things, and even if they don't have an easy solution or we don't know what the solution is or our solution isn't working as well as we'd like it to. um, I think the great thing about this community within the broader Arctic research community is like it's a place to at least have the conversation. So thank you all again for being here and offering up those ideas, thoughts, and comments. And yeah, so starting in January, the drafting team will come together for the next plan. So we hope to hear from you all again in the spring when we've got a draft plan and see how it all came together. And again, like poke and prod and provide comments and thoughts on that first iteration. But happy holidays, everybody.
Thank you.
Thanks.